1.
Hello, good afternoon. My name is Dr. Hamza and I am your treating doctor at Suburban Clinic. Can you please confirm your name and age for me?
Yes, doctor, my name is Smith and I'm 24 years old.
Okay, thank you. Okay, Mr. Smith, how can I help you?
Doctor, I've been suffering from these headaches and they are specifically on the left side of my head. I'm really exhausted now and I think I might be suffering from some kind of tumor.
Oh, I'm so sorry to hear that, Mr. Smith. It must be very painful for you. Mr. Smith, I would like to ask you some questions. Is it okay?
Yes, doctor, that's fine.
Okay, Mr. Smith, have you taken any medications for it?
Yes, doctor, I've been taking some paracetamols, but they are not helping me at all. And I have some nausea as well. I feel sick all the time, and I'm really much worried about this.
Okay. Okay, Mr. Smith, have you experienced such symptoms in the past?
No, doctor, it's very first time I've been having these headaches, and they are there from last few weeks, I would say.
Okay. Does anyone in your family has suffered from such symptoms?
Now, doctor, as you have asked me, I remember that my mother, she died actually 10 years ago. She was suffering because of the similar types of headaches. She was having these and she was taking a medication, barbiturate, and that was, I guess, helpful. If you want, you can, I mean, if it is possible, then can I take the same medication?
Oh, well, Mr. Smith, I will prescribe you medicines, but let me ask you first some questions relating to the disease, to the problem. Okay, Mr. Smith, have you noticed anything which triggered the pain?
Yes, doctor. I have noticed one thing that, whenever I drink red wine, the pain is quite worse.
Okay, okay. And does the pain radiates to any other region?
No, doctor. It is on, left side of my head, specifically at the temple area, and I really need some medication. Please help me, doctor.
Okay, okay. Mm, Mr. Smith, have you noticed any weight loss?
No, doctor, I have not noticed any weight loss at all.
Okay. If you are comfortable, Mr. Smith, I would like to do some examination on you.
Okay, doctor.
Okay. Mr. Smith, based on the symptoms and the examination, it most likely seems to be migraine. And there
Okay,
are
doctor.
various treatment. Let me assure you that there are various treatments available to treat such migraines, which include preventive as well as abortive. So I will prescribe you medications, and hopefully you will um, recover soon.
Okay, doctor.
Am I clear so far?
Yes, doctor.
Okay. Would you like to ask any other questions?
No, doctor.
Okay. Thank you. This is my card. Please, if you have any query, you can contact me. And nice to meet you.
Okay, Dr. Hamza. Let me be very honest. This was really bad. Uh, okay, why I'm saying this is bad? See, you started taking the history of the pain. Okay, remember, guys, I told you in our very first class that this is not a medical exam. Okay, so you don't need to ask me the site, onset, character, radiation, association of any symptoms, timing of the symptoms, okay, alleviating, okay, and aggravating or scoring of the pain. Completely irrelevant. Okay,
Okay, sir.
whatever is mentioned in the card, that is your task. The task in the first task was to ask the patient, take, you have to take a history of the complaint, and taking history of the complaint is fine. You can take it any way you like, but not the way you have taken. Okay, why I'm saying that? See, okay, you don't need to say, see, I have mentioned that I have headaches left side of my head. Fine. You can ask few more questions. Is there any, have you noticed that this is associated with anything else? I would have said red wine. Fine. Then you can ask, is there anyone in the family who has, that is also fine. But taking to this extent where you were just digging so much deep into the medical things. Okay, you are here for the English language exam, right? So we don't need to dig that much. Okay, taking history is fine, but not that deep the way you are going. The other thing, it was really simple to tell the patient, I ask you, I think it is tumor. In the whole your answers, have you ever mentioned that this is not a tumor? This was my concern, right? If you're not addressing my concern, it means you are not paying attention to the patient. Then I asked, my mother died. Okay, no proper response regarding that as well. I said she was taking barbiturates. Can I take those? Did you address the concern? No. Why? Because you were so much into that zone of taking the pain history. Okay. If I am an interlocutor, from my perspective, my card is done when I said my mother died and I want barbiturates. This was my last thing. Okay, if you see the patient card, it is given. The third task was to ask for the medications, just like the mother. So my task is done. Now I am not going to speak. Why? Because I'm done. If I'm silent, how would you now talk? So you have to be smart. You have to address the concern along with it, but complete your task. So after asking a few questions, you could have said, okay, Mr. Smith, I would like to do a neurological examination on you. Would that be okay? Yes, sir. Okay, thank you so much, Mr. Smith, for letting me examining you. After the symptom, after getting the information that you have told me, and after examining you, we believe that the condition you are having at the moment, it is not a tumor, so you don't need to be worried about anything. It is a condition called as migraine. Have you ever heard about? No, doctor. It is one side headache. Okay, of your head. Okay, and where you might have some nausea and vomiting, and there are some trigger factors, as you have told me that red wine, when you take red wine, you tend to have more headaches, okay, and pain. So are you getting my point, Mr. Smith? Yes, doctor, I'm getting your point. So then eventually I would have said, okay, please tell me the treatment. Or you can say, okay, so Mr. Smith, the good thing is that we do have treatment options available. Would you like to hear that? Yes, doctor. And then you can explain that this and that. And eventually then I'll say, I would like to have barbiturates and my mother died. Then you can say, I'm so sorry to hear about your mother. Okay, things responsive. Remember, I told you it is a two-way conversation. You can't speak on your own. There should be no. It is not a question answer session. Okay, like in which you are like patient is sitting and you're asking and you're taking like some long medical history. That will happen in the lab too. Inshallah, you'll be there. You'll be doing these things. Then you can go for Socrates for the pain, OD para for rest of the symptoms. Okay, and there would be no problem for it. But now it is different. It is they have given you the things, follow that. Okay, Dr. Hamza, there's no problem with the English things here. The problem is with the criteria. You have to follow the criteria. Fulfillment of the criteria is equal to pass in your OET. Unable to fill the criteria, no one can save you guys. Okay, I'm being very clear, honest. Okay, and because it is my duty. If I'll not be honest, you won't learn. Okay. So overall, if I say the fluency was okay, there's no problem with the fluency. And Rest of the things are okay. You were asking questions, that is fine. Flow was fine, but so many questions about the pain. But you have to complete your history. Okay, it should be brief, according to the card, and explain the card in a way where which you like which the examiners like. Okay, okay. So that's it.